to bring more transparency into the pricing and the relationships between PBM insurance companies and your retailers. CVS Health Corporation owns both its own PBM, Caremark, as well as the CVS pharmacies that are very close to most Americans. PBMs, as people at home know, are middlemen that handle drug insurance for insurance companies and big employers. There are about 3 PBMs that make up 80% of all prescription drug insurance in the United States. So here again, you have a situation where CVS owns its own PBM and as well as all of the pharmacies. Because they control so many customers, pharmacies feel they have no choice but to join their networks. CVS, through Caremark, is one of 3 companies controlling 80% of the market. But many small independent pharmacies also need to join Caremark to stay in business and serve customers. Here you have a situation where it appears one company has gotten so big that they are controlling market power in a way that might manipulate pricing at the cost of consumers. Examples that we've heard about that we will be looking into are where they've steered patients to CVS stores instead of letting them choose another pharmacy, paying CVS pharmacies more money for the exact same prescriptions than paying independent pharmacies, making small pharmacies go through gotcha audits that delay payments or take money back unfairly, enforcing tough contract rules that make it harder for independent stores to survive. Here in Florida, we want transparency, we want competition. Competition leads to lower prices and ultimately helps our consumers. We've seen reports of cease and desist letters, special rules for hub pharmacies that help patients find better prices and rebates from drug makers that may not get passed on to lower costs for you. I know other states have raised red flags, Congress has raised red flags, and here in Florida we're going to do anything necessary to protect our consumers. So the civil investigative demand is going to ask for documents and questions under oath to determine how they set pay rates for pharmacies. We will be looking for contracts. They never want to turn them over, but we're going to demand it. We're going to want to look at how they might be steering patients and specialty drug rules. We'll be looking at their audits, rebates, and how they treat their own stores versus everybody else. We'll look at plans they may have for buying more pharmacies. So we've given them a deadline of July 26th to get back to us with our initial requests. I think in Florida by now, everybody from big tech to AI to you name it knows that if we have to fight, we will. We'd rather not. We like to work with anybody that wants to help our citizens, our consumers, and our patients. But if we have to litigate, we're certainly not afraid to do it. So I'm honored to be joined this morning by our ACA Secretary, Shevaun Harris, pharmacy owner, Johnny Uthmeier, Florida Pharmacist Association incoming president, Anish Lakhani, and Howard Fabian. We've got some independent pharmacy representatives that are here today, and I appreciate that. We've asked them here to help us as we're seeking transparency in pricing. And I do want to say if there's any effort to punish them for being here, it's not going to go over well. So I thank them for being here. I'll turn it over to hear from our great guests. And again, in Florida, we will always fight to make sure there's an even playing field, that there's fair competition, and that ultimately it is patients and consumers prioritize number one, not big corporations looking just for profit. So Shevaun, I'll turn it over to you. Thank you.
Thank you so much, and good afternoon, everyone. I want to start off by thanking the Attorney General for his leadership, partnership, and relentless pursuit of justice. Today's topic should hit home with all of us. At some point in our lives, we will find ourselves contending with an illness and may require a prescription drug. Hopefully, it's for nothing life-threatening or catastrophic, but no matter the reason, you want to know you can access the treatment that your doctor has prescribed without unnecessary bureaucratic red tape. Pharmacy benefit managers play a critical role in the administration of prescribed drug services for many insurers and Medicaid programs across the country. When done well, they can help insurers protect against waste and can facilitate timely receipt of medications at local pharmacies through efficient point-of-sale transactions. Rising drug costs are a real thing, and PBMs have the ability to negotiate better rates with manufacturers that certainly benefit the system. However, when it goes awry is when profits are put before people. We've seen it time and time again when one entity has too much control and power and they abuse it. When PBMs do it, the people that ultimately suffer are patients and local pharmacy owners. When these harms extend into government programs like Medicaid, it's yours and my tax dollars that are at stake. Under the leadership and direction of Governor DeSantis, ACA has fought against these kinds of practices for years in our Medicaid program. We've initiated audits and studies looking into PBM practices to better help us understand what is happening at the ground level. And without a doubt, it's always been a fight to get the information that we need. But we've made contract changes with our health plans, including prohibiting spread pricing, enhanced reporting, and financial consequences for noncompliance. And we've worked with the Florida legislature to enact meaningful change that would restrict practices that force the little guys, like your independent pharmacies, out of the market, and that prevent vulnerable Floridians from accessing specialty drug products. Unfortunately, we can never take our hand off the wheel or our foot off the gas pedal, because every time we do, you start to feel like you're playing a game of whack-a-mole. There are new schemes crop up that you have to fight against. So when I look at what's going on across the country, multi-million-dollar lawsuits and settlements because of these aberrant practices and the kinds of things that the Attorney General stated earlier, we know we have to continue to do everything that we can to get transparency in the system. So I applaud the Attorney General for today's action. I want you to know ACA is happy to be a partner in this fight. We will provide any resources or information that you need to ensure that these practices stop. The strongest tool we have is accountability and transparency. ACA is committed to ensuring our healthcare system works for patients and not the middleman, and that local pharmacy owners can operate within a system that is fair and doesn't put corporate interests ahead of patient care. Thank you.
Yeah, you could see where if there are rebates or various incentives that benefit the CVS locations over independent pharmacies, that would be a problem. You can see where if there's situations where these guys are subject to audits and extra scrutiny, a lot of harassing paperwork, whereas the local CVS retailer down the road is not, it's going to be a problem. So we've heard a lot of these complaints. We're concerned. Again, we're going to do due diligence. Everybody's got an opportunity to defend themselves, and we're always going to work with people that want to do right by consumers, but we definitely need to take a hard look. So we will now have Dr. Anish Lakhani, incoming president of the Florida Pharmacy Association.
Good afternoon. My name is Anish Lakhani, and I am an independent pharmacist and pharmacy owner here in South Florida. I am also proud to serve as president-elect for the Florida Pharmacy Association, representing thousands of pharmacists and pharmacy professionals across this state. I am here today as a pharmacist, not just as a pharmacist, but as a voice for every independent pharmacy fighting to stay alive in the state of Florida, and more importantly, as a voice for every patient who has been failed by a system that was supposed to be here to protect them. Every single day, I stand behind the counter and watch my patients make impossible choices. I watch elderly patients cut their pills in half. I watch mothers walk away from the counter empty-handed because the copay on their medication that their child needs costs more than they make in a single day. These are not statistics. These are my neighbors. These are your neighbors. And here's what most people don't know. It doesn't have to be this way. Pharmacy benefit managers, also known as PBMs, like CVS Caremark, have positioned themselves as the invisible hand controlling what patients pay, what pharmacies are reimbursed, and also, ultimately, who gets access to life-saving medications. They pocket billions in rebates from drug manufacturers, all money that should be used for reducing costs at the pharmacy counter for patients. They reimburse independent pharmacies at rates so low that we are often paid less than what the drug actually costs. This is not a business model. What this is a shakedown. And Florida's patients are paying the price. As president-elect of the Florida Pharmacy Association, I can tell you that what I witness in my pharmacy is not unique to me. Independent pharmacies across the state are closing their doors at a rapid rate. Rural communities and underserved neighborhoods are becoming pharmacy deserts, and the patients left behind are sicker, less adherent to their medications, and more likely to end up in an emergency room. I did not go to pharmacy school to become a middleman's victim. I went to pharmacy school to take care of people, to counsel patients, and to catch dangerous drug interactions, all while being the most accessible healthcare provider in my community. But I cannot fulfill that mission when I am being financially strangled by a corporation that has decided profits matter more than patient lives. The Attorney General's action today, subpoenaing CVS Caremark, sends a clear and necessary message. The era of unchecked PBM abuse in Florida is now over. My patients deserve better, Florida deserves better, and we will not rest until this system is fully held accountable. Thank you.
All right, next we have Johnny Meyer, who's the Vice President, owner of My Community Pharmacy in Wellington, Florida.
Thank you. First of all, I'd like to say thank you to the Attorney General for having the guts to do this, to go up against a 10,000-pound gorilla. So it takes a lot. No other Attorney General in the country has taken on this burden, so I applaud him. As the Attorney General said, I own a pharmacy in Wellington, Florida. I owned it for the last 17 years. And we opened this pharmacy, my wife and I, to help our community, to provide a choice against the large chains, to give personalized health care to our patients, to get to know them, to build rapport. But with PBMs, they've made it increasingly difficult, day after day, year after year, for us to continue to exist. So what does that do? That decreases patient access, patient choice, and drives up cost of health care. I'll give you a few examples. They inappropriately deny drug requests through systems like prior authorizations. So a physician will write a drug. They don't want to pay for that drug, so they'll make us jump through all kinds of hoops, as well as the physician, in order to provide that drug to that patient or get reimbursed for it. And a lot of times we're not successful. But what that does is that degrades the health care of that patient, because they're waiting for that drug to be dispensed, if it ever gets dispensed. So that is a patient health care safety issue. They don't allow pharmacies like mine into their closed contracts. So, perfect example, I have a technician that works for me. Her mother works at a bank. The bank's insurance is CVS Caremark. But I can't fill her birth control that's sitting on the counter right behind her. She has to go to CVS. I can't fill it for her. So that limits patient choice, patient access. Then they have to order it, and sometimes they don't get it on time, which could be another issue. They only allow me to fulfill a particular formulary. So I can only fill the drugs that they allow me to fill, and they'll send specialty drugs to their mail order pharmacy or to the CVS's, which in turn is a loss of revenue for me for these expensive drugs. So it creates an unfair playing field where they are able to derive that benefit and that revenue, and I'm not, which again goes back to patient access and patient health care and patient choice of being able to choose my pharmacy over theirs. They don't pay for compounds. So just on Saturday when we were working at the pharmacy, my wife ended up compounding a drug for a baby that was just born that they wanted to discharge. Now, if we weren't able to compound that drug, the baby wouldn't be going home, and they wouldn't be going home to their mom and dad. So we were able to compound that drug, but at the same time, the patient had to pay for it, cash out of pocket, as well as her premium that she pays every single month. So they're double dipping there. They're saving on the cost of the drug, and they're getting her premium. But then brings you back to the other fact, if we don't exist anymore, who's going to compound that drug for that baby? Reimbursing us at lower rates than they reimburse their own pharmacies. Again, unfair playing field. They're able to utilize those extra revenues to employ more staff, buy more advertising, get more lives under their umbrella. So they buy drugs at a lower rate than we buy drugs. So that's unfair when we're paying $1,000 for a GLP-1 when they're paying a lot less for that. And then whenever we go to dispense it, we're losing money on top of that. So as Anisha mentioned, that we are underwater on a lot of these claims. And then when we do get a person to come in to our pharmacy, because I met him at a health fair 2 weeks ago, took his blood pressure, talked to him about his meds and his supplements and things of that nature, comes in to try us out. We fill his 30-day supply of Benicar based on the contract that they allow us to fill, just 30 days, and then we charge him $10, which they require us to have him pay $10. He gets a letter in the mail a week later saying, saw that you went to my community pharmacy and got this Benicar. Did you know if we just ship it to you and it ends up in your mailbox, you'll get a 90-day supply at $0? Again, unfair playing field that they're able to benefit from. CVS is vertically integrated, so as the Attorney General mentioned, they not only own the insurance company and all the chain stores that are on the corners, they own doctors' offices, they own a manufacturing company, they own specialty pharmacies, they own group purchasing organizations. It's completely a closed loop, so they're able to keep all that money for themselves, which is the definition of a monopoly. And when they have a monopoly, they can drive healthcare costs up because they have no competition. So increases healthcare costs to all of Americans. CVS and other PBMs, they'll send out audits, as was mentioned earlier, and these random audits that they claim are for drugs that end up being $500, $1,000, $1,500 and north of that. So I don't know how random it is when all the prescriptions that we're being audited for cost those dollars, and there's not the $4 drugs or the 46 cents of Lodipine. It's always those $1,000 GLP-1s and and insulin drugs. So what these audits do is they cause a mom and pop pharmacy like me that's not staffed for this to go and track down all this paperwork, and they try to bury us in these things. And if we don't answer these audits by the deadline that they set, they just take the money back, and we have no recourse. And so even though we've dispensed the medication, the person's used the medication, we have receipts showing that we bought it from our wholesalers, we have receipts saying the person picked it up. Doesn't matter. You didn't do it by the deadline, so we're taking your money back. Or if there's a discrepancy in any which way. So doctor's office has 5 doctors in that practice, and we select the wrong doctor off the top of that prescription, that's a discrepancy, so they just take the money back, regardless of whether we filled it or not, regardless of whether the person's used it or not. So they're able to capitalize on that, and this is all systematic death by 1,000 paper cuts to put us out of business. And I know it sounds like it's all about us and the independent pharmacies, but it's about you guys. It's about the health care of our patients. It's about providing access, providing choices to you guys, providing a lower cost to make drugs for you or provide drugs for you. So I know it sounds like it's about us, but it's about you. So I applaud, again, Attorney General for doing what he's doing and having the guts to do so. Thank you.
Thanks, Johnny, for your witness. We've been hearing a lot of these complaints, and in Florida, we're committed to digging in and getting to the bottom of it. Last but not least, Howard Fabian, who's an independent realtor and was gracious to share some words this morning. This afternoon.
Hi, everybody. This wasn't how I was going to start, but I'm going to start this way because I really didn't know much about any of this until I got a phone call from Johnny. One of the reasons I didn't know about it is because Johnny's never mentioned all these problems. He just takes care of me. And that goes a long way. I met him through a real estate transaction back in 2010. And I've always been big on supporting local and supporting our friends and things like that. So I moved to him. And since we started doing that, I've moved a lot of people to him, because when I used to go to a CVS, you didn't know anybody there. You didn't know anybody that you wouldn't recognize a person that would come from, the previous visits or anything like that. And so you'd pick up things, and you see a lot of different doctors between myself and my family members. And when you do that, you're just picking up what they give you, and you see a lot of different doctors. Like I was a healthcare provider for my mom till she passed last month. My mother-in-law is 94 years old. I take care of her. She's on a million different prescriptions, which Johnny monitors and makes sure that she's not getting different things that are they counter each other. My daughters, things like that. So CVS doesn't do that. They just give you drugs, whatever the doctor says. He was making sure, and his wife was making sure, that there was nothing that they shouldn't have. Then it got to the point where friends of mine were asking, I can't get this or that or the other from somebody. Who do you see? And I would send to Johnny. He would always make sure they had what they had. But it's actually more impressive today. What I'm hearing right now is that I didn't know about any of these problems, and yet they just take care of you. They take care of you like nobody else. But I'll go into what I really started to come here for anyway, which was the assistance that we had. My daughter, who is 35 now, she had an issue many years ago, a skin issue it was a ointment that the doctor said that's the only thing that was working for her. She would try different things. They had a sample at one point that worked. $800, non-covered. Took it to Johnny's office. His wife said they won't cover it at all. She was able to compound a superior medication, $30. Out the door, $30, no problem. Worked beautifully, no issues again. My mother-in-law, like I mentioned to you a moment ago, she takes just a boatload of different things at 94 years old, you can imagine, and always checking to make sure not only that she has everything on time, that she fills everything on time. They do it automatically. Is it convenient? Is it right around the corner? She has a CVS on the corner of where she lives. I won't go in there. Half time things aren't ready. They don't really care. It's that sort of thing. Plus, you just want to make sure you support your folks that are supporting you and taking care of you and looking everything over all the time. My oldest daughter, who's 36, just got to ring the bell at the Sylvester Cancer Center for beating breast cancer. And she just got a clean bill of health yesterday from her oncologist down at Mount Sinai, which is fantastic. We're all very happy about that. And she gets her medications through Johnny as well. And again, the costs are ridiculous elsewhere. Anything that she needs, she gets it. Friends of mine from outside as well couldn't get some things from the regular sources. They go through Johnny. He manages to find them somehow. He's able to get them his resources. Even when we're out of town, we've been on vacations, he's got independent pharmacies that he can contact seemingly in any city that he reaches out to. The personal attention you get when you're in that place. You walk in, they know your name. You walk in the store, they know who you are right away. They pull your stuff, or who you picking up for? How many people today? How many family members are you picking up for? And it's right there. It's right there. It couldn't be more convenient. It couldn't be better. You couldn't be better treated. They're family. They really are. I'm sure these other folks behind me, I don't know them, met them today. I imagine it's the same thing working there. I'm used to, my business is the same way. I'm not one of the big guys. It's Fabian Realty, 40 years, just like that. I've got my daughter works with me. A few other people work with me. We're referral based. I don't want a bunch of other people. I don't want a huge group of people I don't know, I can't trust, I can't contact. I want to know that everybody's taken care of. That's what these guys do. We make sure everybody is cared for. It's affordable. He makes sure he finds what you can't find. He makes sure that there's options for you. He makes sure that in my mother's case, she wanted to take some supplements to help her sleep. They checked them out and make sure that they're okay to take with the medications. A lot of people don't realize this. I didn't, that just because it's not in a prescription drug doesn't mean it's okay to use. I wasn't thinking that way. So you check with his wife. She knows all of this stuff. She's like an encyclopedia of walking prescriptions and supplements. It's fantastic. Quick phone call, and I've never known her not to answer the call. They get right back to you. They don't do that at these other places, any of them at all. Whatever they need you guys to do, Mr. Attorney General, you got to do it. You just have to do it to make sure they stay in there. I never realized how important any of this was. Like I said, I've never heard anyone complain about this until I got a phone call saying, "Hey, could you tell them your stories?" And so here I am, a couple of days later, and it's been a pleasure meeting you guys.
Thank you. Sounds like we all need to get to know Johnny a little better.
Yeah.
I need a friend like that to go out.
Right. Won't hurt at all. And as soon as I read up, of course, I put the correct tie on. But anyway, that's really all I had. I don't have the long speeches. I'm not a member of the associations and all that. I'm just a plain guy from the street that needed some help with the prescriptions and such. Thank you very much for having me, everybody. All of you. Thank you. Thank you for everything you do.
Thank you.
Yeah, I think you can see the personal connection and why it is concerning that a lot of the independent pharmacies are having to close their doors and leave business. So in Florida, we're always going to stand for patient access, patient opportunity, transparency in pricing, and competition, because competition ultimately is going to lead to lower prices, and we're going to fight for our consumers here in Florida every day of the week. So with that, this is the first. We'll have more announcements in this topic to come, but just want to let the people out there know we're fighting for you. So with that, we got time for a couple questions.
Mr. Uthmeier, did the legislation in 2023 not work?
Legislation is currently being implemented. There hasn't had to be any enforcement actions. I know that the companies are trying to come into compliance. I do not believe they're all squarely in compliant at this point. But we're looking both at that legislation as well as antitrust issues. In Florida, we have a lot of antitrust tools where a big corporation might be controlling the market, dictating pricing, leading to anti-competitive behavior. Our office does have the opportunity to step in, and there can be significant penalties where we do see violations of state law.
Is CVS the only big pharma company that's in your?
We're looking at others too. CVS is the first, based on some of the the complaints, some of what you heard today that have already been raised. We'll be looking at others as well, but certainly this is a concern.
Sir, if you could just explain, I know you all spent a bunch of time explaining what the problem is, but again, can you elaborate for us? What is the problem on a granular kind of basis?
Yeah, I think the problem is you've got 80% of the PBM market controlled by three companies. Here you have CVS being vertically integrated, where they are the PBM, deciding where products are going to go, setting the pricing, using various contractual methods perhaps to incentivize certain retailers. And it does seem like they're putting a lot of pressure on the independent guys, treating them differently than their own CVS retail stores, which could very well be anti-competitive. So if they're engaged in kickbacks or rebates or some other price mechanism that's providing disparate treatment amongst their own guys versus the independent pharmacists, then there could be a problem.
So it is accurate to say that PBMs that work with CVS have interactions with independent pharmacies, and is that accurate to say?
That PBMs that work with, CVS has its own PBM.
Correct.
It also has the retail stores, the pharmacies.
Correct.
A lot of these guys still kind of have no choice. I won't speak for them, but seemingly face a lot of pressure where they have to subscribe to the same networks and may have to go through, more stressful, strenuous treatments, audits than the CVS stores themselves. So again, we're at the initial phase of an investigation. We're at the subpoena phase. We can't really go into too much more detail because we've got to dig in, have some discovery, take some interviews under oath, and better understand what the facts of the contracts and relationships are. But thank you for the question.
What's the end game?
Well, the end game is always to make sure we're doing everything we can to fight for our consumers. If there is monopolistic or anti-competitive behavior, it has to stop. That could lead to litigation. I hope not. We always like to go the easy way rather than the hard way if we can help it. But at the end of the day, we need to be able to get in, conduct some discovery. They don't like to turn over contracts. We need to make sure that they're following state law. All right. Thanks, everybody. Have a good one.
Good to see you, Stephen.
How you been? Great to see you, huh? With older and my family. See you well, man.
You too.
Hi to Missy. Hi to Missy.
Okay.